Alright, I welcome you to O'Brien's YouTube channel. So if you are a first year or a second year physician who has not yet stepped his or her foot in the hospital, this video will basically help. So in this video I've decided to make a video on or a lesson on drug prescription and interpretation. So basically how you prescribe drugs and how and what it basically means. So our objectives are the format, knowing the format that we use when prescribing, and how to interpret what you have prescribed. So basically, in simple ways, drug prescription is actually just a verbal or a set of written instructions that you as a physician write, that you as a physician give to a patient on how to take a particular drug. So you need to know to say how you prescribe a drug. It varies from drug to drug. So I'll give you the format on how you prescribe. So basically this is the format that we use when prescribing. So the first part, you write the drug name, then in the same line, then the quantity of the drug, the frequency, the route, and the duration. So we'll talk about each one of these in details and look at an example on how you utilize this format to prescribe a drug. So the first, so basically the drug name, you write down the name of the drug, then the quantity, what it means by saying the quantity is. I've given an example, e.g. Fragile. So one tablet of Fragile is actually 200 milligrams. So that's the quantity. Then you come to the third part, which is the frequency. The frequency is basically how many times the patient will be taking the drug each day. So there are a number of ways that we denote to indicate the frequency. So we've got OD, which means once a day. We've got BD, which means twice, TDS 3 times, QID 4 times. Then we come to the route. So basically the route is how the method of how the patient will be able to administer that drug into the body. So basically we've got these. The route, we've got oral, or if you're taking tablets, or yeah, so it's oral. We've got IV, intravenous, IM, intramuscular, and we've got a rectal. So basically these are just examples of the route of administering a drug into the body. So there are quite a number of them. So now basically after us knowing what this format means, let's now see how we apply this format in actually writing a drug to a patient. So here is an example down here. So I'm sure a lot of us have seen a doctor writing down, or a physician writing down this in our books, or giving us a prescription pad or a leaf which has such format written on it, which you will take to the pharmacy. So we'll be comparing here and the format. So the format says the first thing here is the drug name. So amoxil. Then we come to the second part, which is the quantity according to our format up here. So we've got the quantity. So the quantity for amoxil is 500 milligrams. Then we come to the third part, which is the frequency, which is TDS, 3 times a day. Then we come to the route of administration, it's oral. Then the duration, it's 5 out of the 7 days in a week. So basically, for you to be able to prescribe like this, you need to understand, to say you need to know the quantity of that particular drug. You have to know it, and the route of administering that drug you need to know, and the duration. So you have to know each and every drug. So but these, for you to know, you have to, it comes with practice. So the more you practice, the more you'll be able to know the quantity of any particular drug. So we come to our second part, our second example. For example, salbutamol. So salbutamol, which is also Ventolin. It's the quantity, so the name, then you come to the quantity. So it's 4 milligrams. Then the frequency is OD, once a day. The route of administration is of course pre-oral, and then the duration, it's supposed to be for 1 month. So it will be 1/12. So which is, you'll be taking salbutamol for 1 month. So having us understood the format, so we now come to the interpretation. So what it basically means, or what you have prescribed, what it means, what you have prescribed and what it means. So we'll look at an example. So now we come to interpretation plus and the practical part of our lesson. So in most cases, in our rural setups where we don't have pharmacists, so it's up to you as a physician to prescribe and actually give out the drug. So it's very much important to understand what you have prescribed so that you do not overdose the patient, one, and you should basically not overdose the patient. So we're going to look at what it means when you prescribe. So in this case, we avoid saying to say the first part is the drug name, the quantity, the frequency, the route, and then the duration. So if it's like this, so the interpretation is basically like this. So we're going to look at the interpretation and how you give out the drug to the patient. So, for example, amoxil. So amoxil, the quantity, in this case, you're giving out 500 milligrams to the patient, and this patient will be taking 3 times a day, will be taking the strength of about 500 milligrams 3 times a day. The route is oral for 5 days. So what it means is that you need to take note to say amoxil. 1 tablet of amoxil is actually 250. That's the strength for 1 tablet of amoxil. So it basically means you are giving out, so we have said 1 tablet of amoxil is 250 milligrams. And then you have prescribed 500 milligrams. So it means that this patient will be taking 2 tablets. Because if you say 250 plus 250, it will give us 500. So this patient will be taking 2 tablets of amoxil 3 times a day for 5 days. So now, how many tablets are you going to give out the patient? So we'll come to this formula here on top, which I've just summarized. So the number of tablets that you're going to issue out to the patient, we'll basically find that number by the number of tablets per day multiplied by the duration. So now, how are we going to find the number of tablets per day? So in this case, this patient will be taking 2 tablets for 3 times a day. So it will be 2 multiplied by 3, which is 6. So this patient will be taking 6 tablets of amoxil per day. Now, you want to find the overall number of tablets that you're going to give the patient. So you will say 6 times the duration. So which is 6 times 5, which will give us 30 tablets. So overall, you're going to issue out 30 tablets of amoxil to this patient. So this is basically the format on how to interpret what you have prescribed to a patient. So